There is good evidence that early ablation, we've done a study actually, again, led out of Vancouver, but, across Canada, called Early AF, where patients were randomized to either early ablation or antiarrhythmic drugs. And that study, we participated in another study years ago called DRAFT. There are a number of studies that show that if you have your ablation done as soon as it becomes a problem, your likelihood of doing well in the long run is much better. There's really no reason other than wait lists for ablation and availability of ablation centers and, physicians such as myself who actually perform ablation. Other than the availability of that resource, there's really no reason to try medication first. Yes, it will work, but you're putting yourself at risk for long-term complications where you could just have an ablation with good evidence to say that earlier ablation, you will be much less likely to progress to more persistent form and permanent form of atrial fibrillation, much less likely to get medication side effects. And to be honest, from the healthcare system, it's much less costly to just go to ablation, even though the ablation itself is relatively expensive.
Yeah. So in this case, because you work on all these drugs and you finally get out of AFib based on whatever cocktail works, then, in this person's question is that, is it better to just get ablation right away?
There is good evidence to say that it's better to just get ablation right away.
Even if they went normal, even if they went normal.
You probably don't want to have ablation after one episode of AFib, right? Because your next episode of AFib may be 10 years later, right? So it needs to be a problem. But then this person clearly was
monitoring it, of course.
Exactly, right? And in this person, having multiple long episodes a week, clearly was a problem, right? The problem is that now if, this patient were to stop their amiodarone, they're going to go back into AFib. It's not going to happen immediately because amiodarone has a really long half-life. It stays in your body for 3 to 6 months after you stop taking it. And, but sooner or later, that patient is going to go back into atrial fibrillation. They're only in it because of amiodarone.